All set? Let's get started.
Who identified the ABO blood group system? The correct answer is B. Karl Landsteiner. In the ABO blood group system, which of the following is often referred to as the silent allele? The correct answer is C. O. What is the genetic genotype associated with the Bombay phenotype? The correct answer is C. Severe intravascular hemolysis is most likely caused by antibodies. Of which blood group system? The correct answer is A. ABO blood group. At what temperature do the antibodies in the Bombay serum react strongly? The correct answer is C. 37 degrees Celsius. In which bodily fluid is the normal amount of H antigen detectable for individuals with the para-Bombay phenotype? The correct answer is B. Saliva. What lectin is used to identify secretor status and distinguish Bombay group individuals from normal O group individuals? The correct answer is B. Ulix europaeus. What percentage of individuals typically belong to the A1 subgroup in the A blood group system? The correct answer is D. 80%. Anti-A1 lectin that is routinely used to differentiate between A1 and A2 RBC is obtained from? The correct answer is D. Dolichos biflorus. What distinguishes the A3 subgroup's agglutination pattern when reacting with anti-ACE compared to other A subgroups? The correct answer is C. Mixed field agglutination. Which of the following has the least amount of H substance on red blood cells? The correct answer is B. A1B blood group. What criteria are used to differentiate weak B phenotypes or B subgroups? The correct answer is C. Adsorption elution studies. Which of the following blood groups does not agglutinate with anti-A or anti-B anti-sera? The correct answer is A. Blood group BX. Which of the following B phenotypes has B glycosyltransferase present in the serum but not in the RBC membranes? The correct answer is C. B3. Which of the following immunodominant sugars is responsible for the O blood group specificity? The correct answer is A. N-acetyl-galactosamine. Which of the following immunodominant sugars is responsible for the H blood group specificity? The correct answer is C. L-fucose. Which of the following immunodominant sugars is responsible for the B blood group specificity? The correct answer is B. D-galactose. Which Rh antigen is most common in white people and is important for blood transfusions? The correct answer is A. What is the molecular composition of Rh antigens? The correct answer is A. Protein. Which technology may report an Rh weak D positive as Rh negative? The correct answer is A. Gel system. Which mode of inheritance governs the expression of Rh antigens? The correct answer is D. Codominant alleles. At what temperature do Rh antibodies exhibit their optimal reactivity? The correct answer is D. 37 degrees Celsius. What clinical condition is caused by Rh antibodies? The correct answer is A. Hemolytic disease of the fetus and newborn. What do Rh null cells lack? The correct answer is C. Rh antigens. What is the term used to describe a genetic state in which no observable trait is present? The correct answer is C. Amorph. What techniques are necessary for weak D testing? The correct answer is D. What antibody can a or one R patient make it transfused with? R2 blood. The correct answer is B. Anti-C. If you knew the direct agglutination test is positive, what would you expect the Rh control to be when doing a weak D test through AHG? The correct answer is B. Positive. For lysis of red blood cells to occur after antigen-antibody reaction, which compound is required? The correct answer is C. Complement. What blood type is not possible for the offspring of AL and BO parents? The correct answer is D. All are possible.
That's a wrap. Tally up your scores and let me know how you did. Make sure to like, subscribe, and hit the notification bell so you never miss another quiz video.